So Michael mentioned that he was a little confused about what we were here saying and the cases for it and what legal cases have happened in the past that have not necessarily banned physician-assisted suicide, but the regulations for it as well. The policy that they want to have in place of making the Death with Dignity Act legal nationwide lacks guidelines, and there currently are lacking guidelines for physician-assisted suicide. In the article, what patient and psychologist characteristics are important competency for physician-assisted suicide by Sarah Johnson, she mentions that there are presently no guidelines or recent court cases to provide legal clarification of what constitutes decisional competency in PAS, which clearly there would need to be a direct set of qualifications for a terminally ill patient to be qualified for it, because doctors or physicians who may feel attached to one patient more than the other might feel like it's more, or might feel persuaded to sign it off for one patient compared to another, because based on relationship or based on how they look, how they're feeling, it all depends. And to bring up the article again on 30 logical reasons against assisted suicide by Jane St. Clair. She says, there is no foolproof way to write in the law without opening it to abuse. In Oregon and in the Netherlands, for example, assisted suicide laws require 2 physicians to sign off on a suicide. However, some doctors sign off routinely without examining patients. One Dutch doctor hurried up a suicide because he needed the bed for another patient. And to elaborate more on the regulation of it, the Vermont Alliance for Ethical Healthcare by Marilyn Golden states that once a society authorizes assisted suicide for terminally ill patients experience of unbelievable suffering, it will be difficult, if not impossible, to contain the option to such a limited group. Individuals who are not able to make the choice for themselves, who are not terminally ill, or who cannot self-administer lethal drugs will also seek the option of assisted suicide, and no principled bias will exist to deny. And the last point I want to mention is the progression of legalizing physician-assisted suicide can lead to worse things and more problems. And to bring up the Netherlands again, they enacted the physician-assisted suicide with the intention of it just being physician-assisted suicide. In the article, Vermont Alliance for Ethical Healthcare, again, Marilyn Golden mentions that over the past 2 decades, the Netherlands has moved from assisted suicide to euthanasia, from euthanasia for the terminally ill to euthanasia for the chronically ill, and then from euthanasia for physical illness to euthanasia for psychological distress, and from voluntary euthanasia to non-voluntary and involuntary euthanasia. So from that progression that we see in the Netherlands, we need to ask ourselves if we want that epidemic to be happening here in America as well.